Big money to help small Indiana communities get healthy. Marian University was awarded a $250,000 scholarship today to develop the next generation of rural doctors. WRTV's Simmons takes us to one of the hospitals that it will help the most.
Marian General Hospital is a literal lifesaver in Grant County. It's an island of wellness serving Marian and the small towns around it. Med students from the other Marian, the University and Indy, are crucial here. And thanks to a new scholarship, they are not going anywhere. If you live out where corn is your neighbor, you might enjoy the feeling of having nobody around you. The problem is there are not that many doctors around either, which means rural Hoosiers sometimes just don't go to the doctor.
Patients there were people who, again, haven't seen a physician in 10, 20 years.
Matt Turton saw it for himself and wants to reverse the trend. He's a doctoral student at Marian University who wants to become a primary care physician for the people who need it most.
Get to know somebody and, again, treat them as if they are your family. And that's where the true medicine and healing happens.
Rural hospital systems like Marian Health in the city of Marian try to fill that void, with Marian University students as helping hands. An extra $250,000 for those students may also help. CareSource endowed a scholarship at MU specifically for rural healthcare programs.
All people, regardless of where they live, deserve access to a quality healthcare.
Places like Marian General Hospital are key to that vision. If MGH suddenly went away, Grant County residents would have to go to Fort Wayne or Anderson to find a hospital this large. That's why the university hopes students continue to serve communities like this after they get their doctorate.
They are changing lives. Not only are they changing lives of the residents that they serve, but it's changing their own life.
Turton agrees and is more confident than ever of his path to become a primary care physician if it means closing the healthcare gap in communities like this.
The big difference that I've noticed is in rural underserved areas, since people haven't been able to go see physicians regularly, they're not super familiar with what is an issue that needs to go see the doctor about versus what is an issue they should tough out.
Healthcare itself should not be a tough challenge out here. If hospitals like MGH stay put, there's a chance it will not be. Marian Health hopes some of those doctors in training stay here for another reason. The median age in Grant County is nearly 40 years old, which means there's a lot of healthcare needs on the horizon. For now, in Marian, Simmons, WRTV.